box. Throughout this pandemic, the government has done whatever it takes to protect lives and livelihoods in England, Scotland, Wales, and Northern Ireland. We put in place an unprecedented package of economic support, protecting the wages and jobs of millions of people. We've built the largest testing capacity in Europe, with 32 million tests conducted so far and over 500,000 tests now available every day across the UK. We've ensured, as we head into the winter, that the NHS has at its disposal over 30,000 ventilators and billions of items of personal protective equipment, most of it now manufactured here in the UK. Across the whole of the UK, we have a shared goal to suppress the virus, ensure the NHS is not overwhelmed, and in doing so, to save lives. The UK government and the devolved administrations are working together on a joint approach to the Christmas period because all of us want to ensure families can come together wherever they live. The challenges we face are significant across the UK. The average number of new cases each day is now 22,398. That's up from 9,716 a month earlier. There are now 12,320 patients in hospital, up from 2,602 a month earlier. 1,142 patients are now in mechanical ventilation beds, up from 369 a month earlier. And sadly, 492 deaths were reported yesterday, and the weekly average number of deaths each day is now 295, up from 53 a month earlier. So that's why new restrictions are in place in each part of the UK. And in England, from today, we're once again asking you to stay at home. As I explained on Saturday, you can only leave home for specific reasons, for work if you can't work from home, for education, and for essential activities and emergencies. The full rules, all the details are available at gov.uk/coronavirus and on the NHS COVID-19 apps. And please log on to see what you can and can't do. I know how tough this is for staff in the NHS and care homes who are facing a tough winter on the front line, for families who can't meet in the way that they would want to, for businesses forced to shut just as you're getting back on your feet. I know that many of you are anxious, weary, and quite frankly, fed up with the very mention of this virus. But I want to assure you this is not a repeat of the spring. Schools, universities, and nurseries are all staying open, and these measures, though they are tough, are time limited. The advice I've received suggests that 4 weeks is enough for these measures to make a real impact. So these rules will expire, and on the 2nd of December, we plan to move back to a tiered approach. There is light at the end of the tunnel. We have better treatments and techniques to take care of those in hospital, thanks largely to the ingenuity of British scientists. Rapid testing is being rolled out on a massive scale, with citywide testing starting tomorrow in Liverpool. And I'm hugely grateful in hospital, thanks largely to the ingenuity of British scientists. Rapid testing is being rolled out on a massive scale, with citywide testing starting tomorrow in Liverpool. And I'm hugely grateful to the people of Liverpool for their participation in this pilot. I hope that by working together, we can get that great city on top of the virus. More broadly, there is also the very real chance of safe and effective vaccines. So taking those things together, these scientific advances can show us the way ahead. And in the meantime, this government will continue to support people affected by these new restrictions. As you know, we've protected almost 10 million jobs through furlough, and as the Chancellor announced earlier today, we're now extending the scheme through to March. We're also extending our support for the self-employed so that the next payment increases to 80% of average profits. We're providing cash grants for businesses who are closed worth more than £1 billion every month. We're giving £1.1 billion to local authorities in England to support businesses, and a further £2 billion of funding is guaranteed for Scotland, Wales and Northern Ireland. As we face these challenges together, we must look after those most in need. As of September, we've helped over 29,000 rough sleepers off the streets, 2/3 of whom are now in settled accommodation. Today, we're announcing a further £15 million to help councils offer safe accommodation for people who are sleeping rough or at risk of becoming homeless. This programme will help areas that need additional support most during the restrictions and throughout the winter. These are difficult times, and while it pains me to have to ask once again for so many to give up so much, I know that together we can get through this. So please, for the next 4 weeks, stay at home, protect the NHS and save lives. I'll now hand over to the head of NHS England, Simon Stevens, who's going to talk about the preparations for winter. Simon.
Thank you, and good afternoon. Knowing I was coming over here this afternoon, I took the opportunity earlier today to ask some of my fellow NHS staff, some of the nurses, the paramedics, the intensive care doctors, what they would like to use this opportunity to say to you, the viewers, our neighbours, our friends. And I think it essentially boiled down to these 3 points. First, that this second wave of coronavirus is real and it's serious. Second, that the health service has been working incredibly hard to prepare and to catch up on the care that was disrupted during the first wave. But thirdly, our ability to continue to do that is crucially dependent on what happens to the growth of the coronavirus infection.
Health service
has been working disrupt care. So perhaps I can just spend a moment on each of those 3 points. The first then is that we clearly are seeing a big increase in the number of coronavirus patients in hospitals. Like you, and I'm sure the Prime Minister won't mind me saying so, I've watched a number of these press briefings, and sometimes the charts can be a bit hard to keep up with. So I've just got one chart today that indisputably sets out what we in the health service are seeing. And if we can have that one chart, please. What it shows is the number of patients that are being looked after in hospitals across England. And you can see that at the beginning of September, that was under 500 patients. By the beginning of October, that had become 2,000 coronavirus inpatients. And now, at the beginning of November, that is over 11,000. That's the equivalent of 22 of our hospitals across England full of coronavirus patients. Those are facts. Those are not projections, forecasts, speculation. Those are the patients in hospital today. And as we think about the next few weeks, in a sense, we already know what is likely to happen, because today's infection is the intensive care order book for a fortnight's time. And this little animation, I think, shows that the way this particular virus works means that there are these lags between infections and hospitalizations and either cures or illness severely resulting in avoidable death. So we can just see the little animation. I think that will show that, and up to 2 to 4 weeks between being infected and actually being able to go home well, or unfortunately having died. So the reason why action is needed is because the infections that are happening now are part of what will produce that increase in hospitalizations. Just for comparison, the 11,000 coronavirus patients that we've got in hospital compares with about 3,000 patients that we would typically have in hospital on any one day during a very bad winter flu season for flu. It compares with about 7,000 patients who would be in hospital today being looked after for cancer. And so this is not really speculation, this is fact. And we know that in certain parts of the country, the number of coronavirus patients that hospitals are looking after is already significantly over the number that they were having to cope with during the April 1st peak. But that's not true everywhere, fortunately. We've got parts of the country where actually coronavirus is rising, but nevertheless hospitals are coping well. But if it continues to increase in other parts of the country, it will have knock-on consequences. So we're by no means alone in this. If you look at hospitals across Europe, you can see that they are filling up. Hospitals in the Netherlands, in Spain, in Belgium, in Germany and France. The Chancellor of Germany declaring that German intensive care units would be full within a few weeks. The President of France, President Macron, declaring that French hospitals would be running out of beds if infection was left unchecked. So I think the first point that my colleagues across the health service just really want to underline is that this second wave of COVID is real and it is serious. But the second point is, I think, just to share with you the extraordinary work that they have been doing to ensure that the health service is as best able to cope, not just with the rise of coronavirus, but the usual winter pressures, and of course, all the other care that we offer. So, as the Prime Minister said, we've got new treatments that have been trialled and tested here in the NHS. As a result, the death rate in hospital, for some patients at least, has more than halved since the beginning of the COVID pandemic. We are doing very well thanks to the brilliant work of GPs in expanding flu vaccine uptake this winter, which is so important given that if you have flu and coronavirus at the same time, you're twice as likely to die from coronavirus than you otherwise would. And that's why it's great that 2.5 million more people have had their flu jab this year compared to the same time last year. And as we've been discussing in the last day or two, there are prospects for coronavirus vaccines, and the NHS wants to be ready to administer those just as soon as they become available. We've also been kitting out hospitals and with extra facilities and equipment, expanding intensive care units, 159 A&Es getting investment to be able to separate the COVID from the non-COVID patients they're looking after. We've substantially expanded testing. We've got a 4-month PPE stockpile from the government, and nurses, doctors are going hammer and tongs to catch up on the disrupted care that happened from the first wave. More than 1 million people today will have seen their family doctor or had an appointment. Cancer treatments are now back at above their normal level, and routine operations in parts of the country where there is not substantial coronavirus are now back at approaching their normal levels. So preparation has been substantial. The disrupted care the health service is getting on with tackling. But the third point, alongside the reality of the second wave, the work to prepare that has been done, that my colleagues just fundamentally want to try and convey, is that we do need your help. There is this slogan, protect the NHS. I think from the point of view of people working in the NHS, what that really means is help us help you. Protect our ability to offer the full range of health services, the routine operations, the cancer treatment, the mental health services, the community nursing that is required. Staff are working flat out. The good news is we've got more nurses, 13,000 more nurses than we had a year ago, but coronavirus affects NHS staff just like everybody else, and this has been an incredibly stressful time. So I think I can put it no better in conclusion than the words of an intensive care doctor that I was with yesterday, Dr. Alison Pittard, who said, in the here and now, we can't stop cancer developing. In the here and now, we can't immediately prevent heart attacks or strokes. And hospitals, of course, have got to respond to those. But we can reduce the spread of coronavirus in the community. And that is what we need to do to be able to care for everybody who needs it. Thank you.
Thank you very much, Simon. And I think on behalf of everybody who in government, thank you to you and to everybody in the NHS for the incredible job that you're doing. I want to go to questions from the public, and we're going to start with Tom in London.
Since the first lockdown was eased, playing weekly outside football has been a major boost to both my mental and physical health. Given that fitness and weight are key factors in determining people's risk from COVID, why has this been banned in the new lockdown?
Well, Tom, I know how frustrating it is, and your point, believe me, has been hammered home to me by people across politics and every walk of life for the last few days. I would love to be able to allow this still to go on. It just as we would love so many. I think we'd love to allow so many things to go on for the next 28 days. It is just 28 days. We've got to do this package of measures to get the R down. And I know I recited some pretty gloomy figures that you heard about rates of infection and the number of deaths, the biggest we've seen since May, Tom. But the reproduction rate of the disease is only just above 1, as the scientists, I think, confirm. If we work together on this package of measures that we're starting today, I have no doubt we can make a real impact and allow people like you to play football again. That's, I'm afraid, the sad answer at the moment. Simon, anything you want to add to that?
Thank you.
Thank you. Let's go to Stephen from Shrewsbury. Stephen asks, what consideration has been given to the possibility of only limited vaccine success, and how we live with COVID going forward? Look, I mean, Stephen, that is a brilliant and important question. I think the answer is that in the scientific advances that we're seeing, there are 3 of them. There's a kind of tripod on which we're building, we're resting our program for the way ahead. And one of them is therapeutics and medicines. And you've seen the progress that we've made with dexamethasone and other drugs. Corticosteroid like dexamethasone has real impact in people's outcomes, as Simon was just saying, in hospital. So better medicine is very important. And the other one, if the vaccines don't work, the other one is, of course, the testing regimes that we're introducing. And tomorrow, as I said, in Liverpool, we're beginning an experiment that's really been seen nowhere else in the world, I think, except in Slovakia recently, where we're testing huge numbers of people. We're really grateful for the cooperation of the people of Liverpool. And the advantage of this approach, Stephen, is that you can tell whether people are infectious or not, and in real time, immediately, within 10-15 minutes. And so immediately, without having to worry about the time taken to get the answer from the current testing system, you can help those people to stop the spread of the virus, to self-isolate if they test positive. And if they test negative, then, of course, they're free to do things with other people who test negative in something close to a normal way. So that's the way forward, Stephen. I think if you talk to the scientists, and they will say, in addition, they believe that things will start naturally to improve in the spring for a variety of other reasons, such as the natural rhythm of these viruses and the improvement in weather conditions, which will militate against the spread of the virus. But I think that the real progress we're going to see is with science. And as Chris Whitty often says, there isn't a virus that has threatened humanity that we haven't beaten by science. The number of shots that are currently raining down on the goal is very considerable from the scientists and the doctors, and one of them, I believe, is going to get through very soon. But Simon, anything you want to add to that?
Just on the vaccine point, I completely agree with what you've said. I think the point, Stephen, is that actually there are more than 200 different types of vaccine that are in development at the moment. Obviously, there are 6 that are front runners. There are 2 that are being particularly focused on for the most immediate likelihood, 2 or 3 of getting licensed. But the ones that are most likely to come soonest are, in a sense, some of the cleverest and most innovative vaccine methods, using different types of reprogramming of viruses, or using your own, what's called your own RNA, to produce the immune effect. Some of the vaccines that are more conventional, that are more similar to the sort of vaccine that Louis Pasteur would have been involved in developing. They will come on stream later next year, perhaps the middle of next year. So I think we will have multiple opportunities here from vaccines. It's not just one opportunity, pass or fail.
Thank you very much, Simon. Thank you, Stephen. Let's go to Vicky Young with the BBC. Vicky.
You criticised political opponents who called for the furlough scheme to be extended, and now you've done it. What do you say to those who've lost their jobs because you didn't provide that certainty earlier? And to Sir Simon, NHS staff are again facing huge pressure. Do you think the government should have had a more cautious approach over the summer about lifting restrictions?
Well, Vicky, first of all, on furlough, I think it's been one of the most generous and imaginative schemes that any country has come forward with. Actually, it's been run continuously, as you know, through from the onset of the crisis, from the first need to lockdown, right the way through till today. And as you know, the Chancellor has announced that it's going on till March. To give people the very certainty that you describe, and I think it's the right thing to do. Obviously, you've been, as Rishi, as the Chancellor said earlier on, it was also right when we were going through the period in which we'd collectively been able to depress the R, to greatly to reduce the rates of infection. We need to look at alternative systems of support to encourage the economy to keep moving, to get people back into employment. That was why the job support system, the JSS, was developed, in a different package of measures. But now, as we face this autumn surge, in common, as Simon says, with so many other parts of Europe, it's right to go to furlough, and that's what we're doing. But Simon, on your question. Well,
on your second question, Vicky, I mean, look, it's indisputably the case that we saw a very welcome, substantial reduction in coronavirus in June, July, August. That was evidenced then by the number of people who required hospital care. The NHS used that period to ramp up routine operations, to deal with some of the backlogs that had arisen. But when the facts change, you've got to act in accordance with those new facts, and quickly. And clearly, infections have been increasing, not just here, but across the whole of Europe. And so it is right that collectively we now do everything we can to stop the growth in its tracks.
Thanks very much, Vicky. Let's go to Romilly Weeks of ITV.
Prime Minister, after the pictures that we've seen last night of pre-lockdown parties, do you really think that restrictions can be lifted for Christmas? Won't the desire to celebrate just send the virus surging again? And to Sir Simon, given the pressures on the NHS that you've outlined, do you think it's right to give people hope that Christmas can be salvaged?
Well, Romilly, I perfectly understand why people feel frustrated by the measures that we're putting in, but I also know that the overwhelming majority of people will work together again, as we all have done before, to get the R down. As I say, it's only just above 1 now, only between, I think, 1.1 and 1.3 with the last figures I saw. We can do this. We will do this by December the 2nd. And I have every confidence that we will be able, if we follow this package of measures in the way that we can, and as we have done before, Romilly, I've no doubt that people will be able to have as normal a Christmas as possible, and that we'll be able to get things open before Christmas as well. So the question.
Well, I mean, I think it will significantly depend, of course, on how successful together we can be over the course of the next 4 weeks. We've shown we can do this in the past. We need to do it again. Look, all of us, our families, our parents, our children, we all understand what's at stake here. So we've got a completely shared endeavour to knock this thing off its perch.
Thank you. Back in its box. Beth Rigby of Sky News.
Hello, thank you, Prime Minister. Just a question for Simon Stevens first. Given the current hospitalisation figures and the annual winter pressures, do you accept that realistically we are going to have to be living with some sort of restrictions over December and into the new year? And is that what's going to be needed in order to try and keep routine services going? And to the Prime Minister, can you promise the man standing next to you that you will be able to extend measures, if necessary, on December the 2nd, when over 50 of your own MPs yesterday refused to support the current measures that we are now living with? Or are you going to have to rely on Sir Keir Starmer to extend restrictions?
Simon, you got the first one there.
Okay, thank you, Beth. So again, this will be a function of how well we are collectively able to get the infection rate down over the course of the coming month. But what we're doing in the NHS anyway is we are going to make sure that we've got flexible facilities, that we've got as many nurses able to work as we can, because where coronavirus takes off in a community, that means that NHS staff themselves often are affected or have to self-isolate. Right now, we've got around 30,000 NHS staff who are either off with coronavirus or having to self-isolate. That has an impact. So our success in controlling community transmission of coronavirus also is a force multiplier for what the NHS itself can then provide in the way of care.
And on the question you asked me, Beth, look, I have every confidence that the measures that we've announced, that everybody knows about, that go on till December the 2nd, I have every confidence that it will work, that they will provide Simon and the NHS with the protection that they need. And just repeat the point, they automatically expire on December the 2nd. And I believe that we will then be able to have people across this country will be able to have as normal a Christmas as possible. That's the objective.
Be able to get the vote through. Your own MPs are saying that they're not going to support you.
Well,
What do you say to them?
Beth, what I would say is that I think that you know, I was very, very grateful to MPs for voting through the measures that we did yesterday, and I believe that I'm right in saying that the government was able to do it with its own votes, but obviously it was good that it was this was a measure that was supported by people across all political parties, and that's the right way forward for this country. These are measures that do carry the support of Parliament. That's an important thing. I believe that they'll work, and they will expire on December the 2nd, as I've said, and we'll go. I think we'll then, thanks to the technical advances that we're talking about, I believe we'll be go through into a different period, as I was describing to Stephen earlier. Let's go to Jasmine Cameron Chileshi of the Financial Times.
Thank you. Earlier today, the UK Statistics Authority wrote a letter to Sir Patrick Vallance questioning the data that has been presented to the public. The authority said that some of the data has not always been supported by transparent information, and as a result, there was a potential to confuse the public and undermine confidence in statistics. What is your response, Prime Minister, to concerns surrounding the nature and quality of data being provided to both the public and to MPs?
Well, Jasmine, thank you very much. And I mean, Simon commented earlier about the graphs that we put up. We try to make things as clear as we possibly can. I have to say, Jasmine, that the data I've seen is you know, yes, it varies. The projections vary widely. The scientific estimates do vary widely. There's no doubt about it. Some scientists take very different views from other scientists, and that's why you've also got to add the political judgment that's necessary about the economic consequences of what we're doing, the effect on livelihoods as well. You've got to factor all these things in. It's very, very tough to make exactly the right call. On the data, we're happy to share everything that we have. I just think that there are some things that are irrefutable. I think Simon's first slide was very eloquent, and it simply showed the numbers of people now in our hospitals who do have this, alas, potentially deadly virus, and the numbers of deaths that we heard about last night, 490. That's an irrefutable fact. We haven't seen those kind of numbers since May. So you know, I can't quarrel with those data. We have to act on those data, and collectively, that's what we're going to do. And I know that we can do it. We've done it before. Simon, anything to add on the data? Thank you very much, Jasmine. Thank you. Let's go to Martin Baggett of the Daily Mirror.
Thank you. So Simon, similar to earlier questions, given all the data you've seen, how confident are you that the NHS capacity will be sufficiently relieved by December the 2nd so national lockdown can be lifted? And for the Prime Minister, Test and Trace today reached a new low for the rate of contacts reached. It's having virtually no impact on the outbreak. Is there any point at which this government will abandon its approach of funneling the bulk of funding to outsourcing firms rather than beefing up local public health teams? Wouldn't it be pragmatic to admit that in this case, properly trained public sector employees are just better at it? And wouldn't any legacy costs of improved public health infrastructure be a price worth paying as we try to live with the virus longer term?
Okay, well, on your first question, Martin, as I said with that little animation that might have been too quick actually to really get you, so falling foul of my own keep it straightforward dictum, but the point I think is that the infections that are already out there in different parts of the country last week and this week, they will be next week's hospitalizations and the week after's. But if you look out 3 or 4 weeks, obviously what we are hoping and expecting is that we will not see the large further increase in hospitalizations that the infectious disease experts were telling us would otherwise mean that we ran the risk that by the end of November, we'd got more COVID patients than we had back in April. And by December, that was beginning to, across the whole country, eat into the ability of hospitals to look after lots of other patients. So I think we will know conclusively whether we are seeing that changed increase in hospitalizations by the time we get to December 2nd.
Thanks very much. Martin, yes, of course, I understand people's frustrations with NHS test and trace, and it has come in for a lot of criticism, and clearly it takes, it has taken too long for people to get their results sometimes, but they are improving. And if you look at the turnaround times, they're getting better rapidly at the moment, even though there are huge numbers of people being tested. They got the capacity, the capability up to 500,000 per day. It's the biggest diagnostics industry, diagnostics capacity anywhere in Europe. I think more than 30 million tests have now been conducted. And I think I would really disagree with what you said about it having no impact. Yes, it hasn't had as much impact as we would have wanted, but there's no doubt that by identifying people who have the disease, identifying the localities where people have the disease, we've been able to get the R down in a way that I don't think we would otherwise have done. So it's had an effect in helping to reduce the spread. And what I'm so hopeful about testing, because the PCR testing that we've relied on, we now have this 500,000 polymerase chain reaction, I think it is, tests, yes? Yes, tests that we're able to do. We now have a big capacity now to use those in other contexts. As Simon was saying a bit earlier, we're also able to use a new type of test made in this country called a LAMP test, which is a rapid turnaround test, which will help us to identify asymptomatic people in the NHS, nurses, doctors and others in care homes and perhaps in other settings. But there's also, as I said, these immediate tests that really require very little supervision at all. And eventually you may be able to administer yourself the so-called lateral flow tests. And these, when they're of the kind that we're going to be trying in Liverpool tomorrow, and I think these really are full of promise. I do think that testing does offer a real way forward for this country, and a real way forward through the crisis. So, Martin, I'm going to accept the criticisms that people make about many aspects of NHS tests and trace. And yes, I think one of the real problems we've had is getting people to self-isolate in the way that they need to. And I do really stress how important it is to self-isolate when you're told to by NHS test and trace. It is vital for breaking the chains. But when you move as we will to ever more immediate test results, you help people to know whether they're positive or negative in real time, as it were, and so you're gradually able to remove the need for that quarantine and that period of self-isolation. So I think that is a really promising development that we intend to exploit. So I'm to the full. Exploit to the full. So I am very optimistic, Martin, about testing generally, and wouldn't want to see it unnecessarily run down.
Well, I mean, just building on that, I mean, the way I would say it, Martin, is I think there are sort of three lines of defence. The first line of defence is the amount of human-to-human transmission that is occurring, social contact, the physical distancing, the hands, face, space behaviours that we all engage in. The second line of defence then is testing and tracing and isolating. And as the Prime Minister says, given that quite a high proportion of coronavirus transmission happens either before you have symptoms or when you don't have symptoms, actually being able to do mass testing for people who aren't experiencing classic coronavirus symptoms is going to be a key to that second line of defence. And then, and only then, the third line of defence is actually what happens in specialist hospital care, including in intensive care units. And the right way of thinking about the intensive care unit is if you just rely on the intensive care specialists, that's like taking all the rest of your team off the pitch and just leaving the ICU doctor as the goalkeeper to defend.
Thanks very much, Simon. Let's go lastly to Lawrence Darnhill of the Health Service Journal.
Thank you. For the Prime Minister, more than 1.2 million people are now waiting for an NHS diagnostic test for non-COVID conditions, which is up from 800,000 in March. But NHS scanning capacity needs to double to reach the average of other advanced nations and to properly deal with that backlog. Will you give the NHS what it needs to buy that kit and to pay for the additional staffing costs? And for Sir Simon, does the size of the NHS waiting list next year depend on the level of additional funding which has still to be negotiated with the government? Well,
Lawrence, quickly on that.
I didn't, that's not my brother or anything, sort of phoning in with that question on the funding. That's just
no. But I obviously,
yeah, but I appreciate your question.
No,
Lawrence,
but let me preempt that. Obviously, you must answer it too. But look, you're quite right, Lawrence, in the sense that the pressure on the NHS caused by COVID has made lots of other diagnostics, pressure on all sorts of other tests. But what we want, that's why we need to depress the virus now. But your basic question is about the level of investment, and there's never been greater investment in the NHS and under this government. £34 billion package. I seem to remember announcing a £360 million package of investment in MRI scanners and other forms of scanners only recently, or just before COVID began. What we're also doing, of course, as important in a way as investing in the kit, because we need more kit, we need more scanners of all kinds, but we also need the trained staff to operate them. And that's why we're recruiting. I think just in the last year, we have 13,700 more nurses in the NHS than there were a year ago. And we're going to continue to expand staffing levels, because you can't do it, no matter how good your kit is, you can't do it without the staff. But anyway, Simon.
Yeah, no, thank you. Well, so Lawrence, yes, on the diagnostics, i.e. the scanners, the MRIs, the CTs, the other investigations. We have just, as you know, commissioned a report from Mike Richards, who has said that we substantially need to expand our diagnostic capacity to deal with the testing that you describe. And where we're going to do that is not just by putting more scanners in hospitals, but also using the opportunity to put them in high streets, in retail locations, so as to expand the accessibility. That obviously will need to be backed by investment, which we expect to get. And in terms of your second question, the waiting list, as you know, there were predictions back in the summer that the size of the waiting list for an operation would be perhaps 10 million people by Christmas. Fortunately, that's definitely not going to be the case. I think we can now say confidently, I think the work that hospitals have been able to do in this window of opportunity while COVID has been low in June, July, August, September, October, and still in most parts of the country where there's not substantial coronavirus outbreaks, that I think is something we've got to hold on to and build on. And then I think your last point is that looking forward, the key constraint, I think, is going to be, as the Prime Minister says, the staff available across the health service. If there's one small silver lining to have come out of the huge commitment and sacrifice that health service staff have made over the last 9 months, is that they have inspired a new generation of young people to want to sign on to become the nurses and doctors and therapists of the future. And in fact, we're going to have the biggest intake of new undergraduate nurses that we've had in a decade this autumn. And we've seen applications for medical school to become doctors up by nearly a quarter. So that doesn't provide an instant answer, but it provides some reassurance about the future.
Thanks very much, Simon. Thank you, Martin. Folks, that brings us to the end. Science is improving the whole time, and we are, as a country, in a far, far better position now to fight this disease than we were in March, and we will, in the weeks and months ahead, be in an ever better position. But from now until December the 2nd, I must, alas, ask you once again to stay at home, protect the NHS, and save lives. Thank you.